Good morning, everybody. This is the Anchorage Emergency Operations Center operational update for the 19th of August. All right, situational overview. Locally, cases are up 1,048. We have 5 new deaths and 38 new hospitalizations. Statewide, we're at 3,112 cases, 7 deaths, and 38 hospitalizations. 213 resource request update. We have filled or satisfied 1,801. Filled 2 since the last report, and we're currently working 11. Our congregate shelters are at Sullivan is at 350, up 11. Non-congregate is up 9 to 406. All shelters 699, down 12. For vaccines, we have sampled 5,992 samples collected and distributed a total of 89,281, up 195. Weather, go ahead.
Good morning, everybody. So high pressure today is going to keep conditions mostly sunny. Short-term concerns really entail only the development of turn-again winds later this evening. Those should strengthen into the overnight hours, probably peaking between 2 and 6 a.m., maybe some gusts up to 25 miles per hour. But that high pressure is going to get pushed out of the area tomorrow. We have a low pressure system and an associated front coming in on Friday with an 80% chance of showers. Then high pressure will return over the weekend on Saturday, briefly, keeping mostly sunny skies on Saturday. Sunday will likely start out pretty good with mostly sunny skies, but the next low pressure system will be moving through the Aleutians over the weekend, and will probably push high pressure out east of us by Sunday, and so you'll see those shower chances increasing Sunday, and then by Monday, rain chances become much more likely. Otherwise, no major impacts. That's kind of what I've got right now.
All right, thank you, Weather. Testing, vaccination, go ahead.
Good morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare observed the following over the previous 7 days. A 1% increase in sample collections from community and priority populations. In this is a 1% increase in sample collections at the community testing locations and a 5% decrease in sample collections of priority populations. Our samples have been averaging about 27 hours for notification of the results over the last week. Cases in the community and priority populations are continuing to increase. We're averaging 128 cases per day, and our 7-day average positivity rate is 7%. As of August 17th, our estimated daily growth rate is 2.58%, and cases are predicted to double in just under 27 days. Our 14-day average reproductive rate is 1.107. A reminder that a reproductive rate above 1 indicates that the virus is still continuing to spread. And our 14-day average case rate is 47.3 for every 100,000 residents. Our current alert level is high, and this indicates that there is widespread community transmission with many undetected cases. The vaccines, Visit Healthcare clinics had an increase in the average daily vaccination rate of 13.9% from the previous week. We have a few upcoming pop-up vaccine clinics. Today we have the Foo Fighters outside of Denina. This will be from 1:30 to 4:30 p.m. Tomorrow we have Tasty Freeze from 4 to 8 p.m. And Saturday we have the Alaska Craft Brew Festival. These will be from the hours of 12 to 3 p.m. and 6 to 9 p.m. Finally, just a reminder, our mobile vaccine clinics can come to you wherever you are, be it a church, business, or other organization. For more information or to schedule, please dial 907-531-5100. This concludes testing of vaccines. Barring any questions, end of report.
All right, thank you, testing and vaccine. Contracts and logistics, go ahead.
Good morning. This is Wendy Reese, Contract and Logistics Section Lead, reporting. Mass care sheltering support is extended through 10/31, all the contracts. We are currently in the process of demobilizing the Sullivan Arena shelter, scheduled for September the 15th. Our testing contract with Visit Health is extended through August the 25th. It's on the assembly for approval for an extension through October 31st. The vaccination contract modifications, we improve all overall vaccination capabilities. We have currently set up some new drive-through testing sites. We currently have 11 resource requests, 2 of which are personnel, and we continue to make ongoing staff adjustments to meet COVID mission requirements. End of report.
Thank you, contracts and logistics. Next up, finance. Go ahead, ma'am.
Good morning. This is Audrey Jo Malone reporting for Finance. Today, August 19th, current encumbrances are $17,524,940. Actual spent to date is $72,983,180 for a grand total of $90,508,120. As always, we are constantly working on cost recovery for expenses by way of federal funding. And as always, please continue submitting invoices and supporting documentation to eocinvoices@anchorageak.gov. End of report.
Thank you, finance. Up next, we have safety. Go ahead.
Good morning, everyone. This is Annalisa Roberts reporting out on this sunny Thursday morning for safety. So we've still got the Delta variant going through, and it is getting pretty bad. It is more contagious than previous strains and causes 2 times more infections. Vaccines still protect against the hospitalizations, severe infections, and death. And while fully vaccinated people with the Delta variant breakthrough infections can spread the virus, they're less likely to stay infectious as long as a person who's unvaccinated. So unvaccinated people still remain the greatest concern for the Delta variant. Also, the CDC is now recommending that individuals who are moderately to severely immunocompromised receive an additional dose of the mRNA vaccine at least 28 days after finishing their Pfizer and Moderna series to ensure that they reach the same levels of immunity. If you have any questions about that, talk to your healthcare provider to see if you're in that group. That right now is all the CDC is recommending for the populations to get that additional dose. And report.
Thank you, safety. Up next, public information. Go ahead.
Good morning, everybody. As mentioned earlier, there's some pop-up clinics coming up. One of those is being hosted by the Anchorage Health Department at the Alaska Brewfest this Saturday on 8/21. We just continue trying to meet people where they're at with those vaccination clinics to make it easy for them to make the choice to get vaccinated. We are messaging about the 3rd dose for the immunocompromised individuals, and also about how the CDC and the US FDA monitor COVID-19 vaccines for safety. We are also reviewing data on the July vaccination clinics to find any common factors that make a clinic successful. We'll use this information to inform where, when, how we promote clinics in the future to hopefully encourage more people to make the choice to get vaccinated. Barring any questions, that's it for public information.
All right, thank you, ma'am. Liaison, go ahead.
Good morning. This is Driel Welch, COVID lead for the Anchorage Emergency Operations Center. Thanks to all of our partners who are able to join us today. We'd like to get started with Jim Baldwin, if you're available.
Good morning, everyone. Jim Baldwin at the Food Bank of Alaska. Thank you for adjusting the time frame so that we can participate in these calls. The Food Bank of Alaska has completed our move into our new facility located at 2192 Viking Drive. We are fully operational in this new facility and ready to.
Okay, we'll come back to him.
So yep, we can come back to Jim if he's able to connect back in. Are there any other cooperators that would like to report out?
This is Ron Swartz, OEM at UAA.
Go ahead, Ron.
Saturday the 21st, we're hosting the annual campus kickoff, a large event for returning students for the fall semester. It'll be outside the Alaska Airlines Center, which is also the location of the Muni mobile testing site. So testing for that day only will be suspended. End of report.
Thank you, Ron, for that update. Are there any others? Okay, next slide, please. Is Lieutenant Cooley on for JBER? Okay, not hearing him. These are the numbers that we received last week for vaccinations from JBER. So the Army has currently vaccinated 188 first doses, 2,926 fully vaccinated, and 1,302 are unvaccinated for the Army. And then on the Air Force side, they've administered 71 first doses, 3,724 are fully vaccinated, with 1,818 unvaccinated. And we'll work to get updated numbers for this current week. Next slide, please. All right, and now we'll move on with the hospitals. Is anyone on from ANMC?
Yes, good morning. This is Colleen Fett, reporting on behalf of Lori Olson. This morning we had 23 COVID positive inpatients, 4 in the ICU, 2 of which are vented, and then 19 on the adult med surg floors. Yes, we have a modified incident command operational. No, we have not activated the decompression plan. We are actively managing the elective procedures. We have activated our alternate care site on campus and utilizing that now with patients and staff. We have not recalled staff. We have not initiated non-routine hospital-to-hospital transfers, and immediate needs are staffing and capacity. We also do not have any COVID patients in the ICU under the age of 12, any ICU and under the age of 12. And then are the hospital patients vaccinated or unvaccinated? Anecdotally, we're not tracking this, but mostly unvaccinated. It is significant that for ICU level care, ANMC has not had a fully vaccinated COVID positive patient that has been admitted for COVID related symptoms. We are anecdotally seeing patients with a lot of comorbidities, although again, we're not tracking that. We're sending all ECMO patients out of state. Staffing is concerned for us, and we are actively working with traveler contracts. And if the ACS is demobilized, are there concerns with hospital surge? Yes, if rates continue to increase and surge beyond our capabilities. End of report.
Thank you for that, Colleen. Is anyone on from Alaska Regional?
Good morning. This is Sean Murphy from Alaska Regional Hospital. Can you hear me?
Yes, I can.
Okay, excellent. This morning, briefly stated, Alaska Regional Hospital has 25 positive COVID patients, 5 in the ICU, 3 vents. 5 of the 25 inpatients were vaccinated. We currently have no PEDS COVID patients. Our biggest pressures right now are tight staffing and tight beds. End of report.
Thank you for that, Sean. Anyone on from Providence?
Yes, good morning. This is Nikki Holmes on for Providence. Today we have 23 positive COVID positive patients, 8 in the ICU, 5 on mechanical ventilation, 13 COVID recovered. We have limited activation of our incident command post, focusing on capacity and staffing. We have activated a decompression plan, working on throughput patient flow. We did cancel some elective procedures on Monday and Tuesday of this week for patients that would be hospitalized. We have not activated an alternate care site. We are not recalling staff, but maximizing staff as we can. We have not initiated any non-routine hospital to hospital transfers and have no immediate needs. Thank you.
Thank you, Nikki. And Kara, are you on for Matsu? All right, not hearing Kara. We have she did report out this morning. They have currently 16 COVID positive inpatients, 7 are in the ICU, 6 are on ventilators, and 0 PUIs. And that's all for liaison. Thank you.
All right, thank you. In the chat, we do have a question that went for Mr. Ford, if he's still on. They're looking at what day will testing be suspended at UAA.
He reported Saturday the 21st as they do their annual campus kickoff. So Saturday the 21st.
Thank you. Okay. I do have a hand up.
Hi, this is Jim Baldwin. Can you hear me at the Food Bank of Alaska?
Hear you loud and clear. Go ahead.
Great. Sorry, we're having some phone problems here. So I'll just give a brief update since I got cut off. The Food Bank of Alaska has completed our move into our new facility located at the 2192 Viking Drive. Like I mentioned, our phone systems are kind of wonky right now, but our email, internet is all up and running. Hopefully by the end of the week, we will have phones fully operational. We are fully operational at this new facility, ready to respond to any additional needs beyond our normal operations. We did provide a tour to Mayor Bronson on July 28th, and I would like to extend an invitation to any EOC leadership members that want to come by and schedule a tour of our new facility. Just let me know, preferably email right now. And then we are requiring masks. We implemented mask requirement wearing while in the facility effective this week. End of report. Thanks for your patience.
Thank you for that, Ron. And it does look like, Jim, you have your hand up.
That was me.
Oh, okay. Sorry about that. Were there any other questions? All right, I'll hand it back over to Adam.
All right, thank you, ma'am. All right, just as a reminder, our next operational update brief will be next Thursday at 10 a.m. Thank you all and have a great day.